and then measure active range of motion. Okay, so we're back to that routine. We fell out of that routine. So the other thing that you need to consider when you're working with the hip is what the pelvis is doing. So we don't want the pelvis to be moving when we're measuring hip motions. So it's really important when you're measuring hip flexion that you make sure that the pelvis isn't moving and that you stop the movement at the hip as soon as you feel the pelvis start to go. Okay? Now, the other thing is when we're measuring hip flexion, goniometry, do we want his knee straight or bent? Bent. Why? That's the correct answer. Right. Hamstrings are going to be tight, and that might be limiting the motion. If we're just wanting to know what the hip motion does, we want to keep the hamstrings on slack, and so we're going to have the knee bent. Okay? Now, what you don't want to do is get in the habit of, go ahead and show it for me, there you go, is pushing down like this, because you're going to be putting too much pressure on the knee in that position. Okay? So what you're going to want to do is, for big, long legs, is go like this. I can say that I have a pair of my own. And I'm going to bring him forward. Okay, and now his pelvis is starting to come up. Okay? So
where on the pelvis are you holding it?
So I actually have my finger on his PSIS.
Okay.
What Berryman Reese says is that you should have your hand over here. I don't know how you physically do that with only two hands. So that is how I would do it.
Okay, so PSIS.
Okay?
On the same side.
Yeah, because all I care about is I don't want that pelvis to rotate. Now, because legs tend to be heavy and big, I don't have a problem with asking the patient to physically hold it with their hands once I get them in the position I want. Okay? So, come back up again. I know actually like for me. When I give more motion, did I stretch you out?
Maybe.
Okay, can you hold it there for me? There you go. Oh, don't go more.
I didn't know it was.
Big cheater. So, go ahead and relax your leg. So for goniometry, you can go ahead and put it down. I realized we didn't talk about landmarks. So, stationary arm, if we're measuring hip motion, what's it going to be? Don't need to look at the slide. What is it?
Trunk.
Trunk. Mid-axillary line, right?
Mm-hmm.
What are we going to do with the moving arm?
Femur. Bisect the
We're
femur.
going to bisect the femur. I gave it away and told you the axis was going to be greater trochanter, right? Okay? So, I'm going to find the greater trochanter, which, yeah. If I couldn't find it at Scott, that'd be a problem. Right? Apparently, they're worse than Twizzlers up front. Okay, all yours. There you go. What did you hear?
That was titanium rods that were put in my femur.
Nice.
I have them. They're blue. They're pretty cool.
That's where saying awesome is maybe not the right response to most people, although I can tell Scott's proud of his titanium rods. Go ahead and come back down. Now, I know I started here and went all the way around, so my goni's reading 65, 66, 64. That's not right, right? So it's 90, 100, 110, 116. Because we started here and went past 90 that way. Okay? Normal is 120. It's not bad. Okay? All right. So the two other measurements that we're going to do in supine is adduction and abduction. So obviously for active range of motion, I would be monitoring the pelvis and I'd ask him to bend his knee up to his chest, would be my instruction. Okay? I would tell him to stop when he got to the place where I wanted him, where I felt there was movement, and then I would take that measurement. Now, one thing I didn't say is to get end feel, you're going to have to take him to his extreme of his motion and let the pelvis move to actually get the end feel. Okay, so I did not demonstrate that. So go ahead and relax for me. Okay, and with it, so I think that was more muscular than capsular. Okay. In class, you're going to feel both, depending on your person. All right, but you can see I took him a lot further. I had to take up the motion in his pelvis to be able to get to that end feel. If I simply tried to do the end feel without, I would have to stabilize his pelvis pretty well if I was going to try to get an end feel at his normal end range of motion of just his hip joint. Okay? All right, abduction. Gonna feel for end feel. That's definitely muscular. Okay, so now we're doing a motion in an orthogonal plane. Where do you think the stationary arm would go?
Between the two ASIs.
Okay, so for this one, we are going to go across the ASISs. So it's a little bit different than how we do shoulder abduction. There you go. And we're going to bisect the femur again. All right? Your shorts are lopsided. Didn't I just say don't go on clothes?
What?
Don't be based on clothes. Your shorts are lopsided, and I was looking at your sizes and that on me. Okay, so go ahead and relax your leg and let me just take it. Let your knee go ahead and bend for me. There you go. Okay. Doing the tape measure this way allows for, do you see how his pelvis did move a little bit with it? But so did my goniometer. Okay. Then I just bisect the leg. All right. Let's go ahead and bring you back up. So it would have been passive range of motion, and he went 0 to 38.
So you started at 90, so
Mhm.
you would put him in 90 before you.
Yeah. Right. For adduction, the goniometer placement is going to be exactly the same. You need to move the other leg out of the way. Okay? And now I'm going to be monitoring his pelvis. There you go. Goniometer. And 0 to 19 degrees. Okay, you're really kind of normal.
Norm for adduction.
Yes, 20 to 30 degrees. There are norms for adduction for that. We're not bringing the leg up and over like we are for the shoulder, and so we do have norms for adduction. Okay, so in supine we've got flexion, adduction, and abduction. I'd like to go ahead and show you medial and lateral rotation, or would you like me to stop? Keep rolling. Okay. So for this one, I need you to sit on the side for me.
Are you expecting me to not be normal?
I was, actually. Thank you for proving me wrong.
Do I get a stool?
No. Go ahead and lift this leg up. You want the leg to be dangling. It's okay, everyone. We'll give him a stool on the other side. Okay, here's a gasp. We have gasps. You're okay. There you go. All right. So, if you remember in 356, we have low mat tables. Measuring hip rotation on those tables is very, very difficult to do. So it's a lot easier on these higher tables. I have a stool behind you. Yeah. Or I can take yours. Yeah. All right. So, just like, if you remember when we measured shoulder rotation, we had the person at 90 degrees of abduction, and then we measured kind of along the axis. We're going to do the same thing for hip rotations. So you want to make sure that the hip is at 90 and the knee is at 90. Now, if Scott brings his ankle out, is he medially rotating or laterally? Oh, you are limited. I knew we'd find something. Is he medially rotated or laterally rotated, or internally or externally rotated?
Medially.
Okay, he's medially rotated. And how about if he brings his foot in?
Lateral.
Okay? So go ahead and relax. So we can measure those from this position. We're actually going to manual muscle test them in this position as well. So the axis is going to be the inferior pole of the patella, and we're really just thinking of that axis going right along his femur. Okay? The stationary arm is going to be perpendicular to the floor, whichever direction you want. I'm tall, so I like to put it this way. The moving arm is going to go right along the shaft of his tibia. Okay? I'm going to just show active So I'm starting to feel lazy. So let's do medial rotation. So go ahead and bring your ankle out. Okay, keep your leg down on the, there you go. All right, relax. That's 0 to 30.
It's normal.
That's not far off. 30 to 40. You look more impaired than that. Go ahead and bring this one out. Yeah, that wasn't very nice. Sorry. I told you I've got this. I've got Kalen.
Yeah, I'm sorry.
I'm cheating Kalen.
I mean, I may be,
Are you
I don't
cheating
know.
my humor today?
Maybe I'm compensating in some way or something.
And there you're at 0 to 25. So that's good. That's more restricted. Okay, so that's how you're going to measure medial and lateral rotation. Okay, so you're going to do it in sitting, and actually, like I said, you're going to do manual muscle testing in this position as well. So usually you would just do all 4 of those tests right away. The last goniometric measurement is extension. It's going to be the exact same thing, same landmarks as we used for flexions. Go ahead and lie down on your stomach. Put your head down there, feet hanging off the edge, please. Do you want anything to be more comfortable?
I'm fine.
You're good, okay. Alright. So here again, we really don't want to see him go into an anterior pelvic tilt when he lifts his leg. So I'm going to have you lift this leg up for me, please. Okay. And come on back down. So I'm monitoring his PSISs. I'm looking to see if they go up and anterior. Alright. Go ahead and lift up again. Okay. So right about there before his pelvis starts to move. Alright? The exact same landmarks that I used before. Now we don't want his knee to be entirely straight when he lifts up. Okay? Go ahead and relax. But we don't also want to have it completely bent, because now we're going to have the hip flexors that are going to be on slack if we have it bent like that.
So should you cue him to like tighten up his core to try to keep that pelvis from not falling too anteriorly, or just let him do whatever?
Yeah, so you certainly could do that. The problem is that then you get a lot of, it depends if you're doing passive or active. If you're doing passive, I would not do that. If you're doing active, like I've been demonstrating, the only concern I would have is that people will tend to contract both anterior and posterior muscles, and then you might get co-contraction of the hams and quads, and then you're in trouble. Okay? So you can try that with someone, and it might work really well. Other people, it may not work so well. Okay? But that's essentially what you want to do, is make sure that their pelvis isn't moving.
I have a question for the medial and lateral.
Mm-hmm.
What's the normal end feel for that?
So we're not talking about what is normal
Right.
this semester. I would expect that you're going to feel capsular, although for some of your people, your piriformis is going to be tight, so when you go into internal rotation, you might have a muscular end feel. Okay? All right, so that's actually all 6 of your motions that you have to measure goniometrically. See how much easier it is now we're at the hip than when we started at the shoulder? It all feels so simple, right? So simple. Okay.